Hello. So the six rights of drug administration are right patient, right route, right dose, right time, right drug, and right documentation. And today I have Mr. Pat Jones that I'm going to be medicating. Mr. Pat Jones is an 85-year-old male, and his diagnosis today is dehydration, confusion, duodenal ulcers, diabetes, mellitus, peripheral neuropathy, and depression and COPD. He doesn't have any drug allergies, but I'm still going to ask him. And I'm going to be giving him his morning meds. So he's going to be getting insulin, and he's going to be getting Docosate 100 milligrams, gabapentin 600 milligrams, escitalopram 10 milligrams, omeprazole 20 milligrams, and then he's going to be getting IM injection of morphine. His pain today is a 8 out of 10, so he's going to be receiving 6 milligrams of morphine. And his blood sugar, his blood glucose this morning was 276, so we're going to add an extra 6 units of insulin on top of his normal 12 units, which is going to be 18 units total. So I'm going to be getting the meds ready from the cart here. Actually, before I do this, I'm going to wash my hands. Okay. So, get it ready. Put all my stuff. The right ones. I need more alcohol swabs. And needles. Does anybody have any alcohol swabs and needles? No, it's all right. We got it. Here, I'll take the alcohol. Thank you so much. Perfect. Hand me one of those. Thank you. All right, my assistant brought me some needles because the cart was out. So switch that with that. Call it a day. Where was I? His meds. So I'm going to look at his MAR, and first thing I'm going to get is his insulin flex pin, which is right here, and it says Pat Jones, has his birthday, and it is not expired. So this is his insulin flex pin that we're going to be using to administer his insulin this morning. All right, now I'm going to get his PO medication. So I'm going to start with his Docosate, which is right here. So this is Docosate 100 milligrams, and he was ordered Docosate sodium 100 milligrams, Docosate sodium 100 milligrams. Okay, and then next he was ordered gabapentin 600 milligrams. So what I have here is gabapentin. They got it. Gotta see. Gabapentin 300 milligrams plus 300 milligrams equals 6, and then here's the Docosate 100 milligrams for the previous one. And then escitalopram, that is going to be escitalopram oxalate, which is 10 milligrams. Right here, escitalopram oxalate, 10 milligrams. Okay. And then we have omeprazole, 20 milligrams. And I have omeprazole 20 milligrams here. Omeprazole 20 milligrams. Okay. So now I'm going to be drawing up his morphine. kind of empty. This one looks a little better. Perfect. Wait. Perfect. Okay, so take the morphine, clean the cap here. And then, since his pain is 8 out of 10, he needs 6 milligrams of morphine, and this is 10 milligrams per milliliter. So what I'm going to be doing is I'm going to be drawing up 0.6 milliliters total for his IM injection of morphine. What I'm going to do is I'm going to drop 6. There's some air, so I drew a little extra. I might have to waste some of this. So I'm gonna get my nurse coworker here. Can somebody watch me waste this?
Mm-hmm.
All right. So what I'm gonna do is I'm gonna get the air out real quick. Okay, so I'm gonna waste down to 0.6, which is almost there. Come on, get out of there. There we go. So I'm gonna waste down to 0.6, which is right there. Okay, so now I'm gonna engage my safety. Actually, I don't have another needle. So what I'm gonna do is I'm gonna put this cap on with this method here. Okay, so that is 0.6. Can you verify that's 0.6?
That is 0.6.
0.6 of 0.6 of morphine. Okay. So now what I'm gonna do, after the morphine's drawn up, I'm gonna drop his insulin. So what I need is a needle for this guy. Turn this guy off real quick. Put this on. Okay, so he needs 18 units of insulin. What I'm going to do is I'm going to prime with 2 units of insulin, so it gets the needle primed, and then I'm going to drop 8. Wasn't supposed to happen. I'm going to drop 18 units of insulin. And can I have you verify that that's 18 units of insulin?
That is 18 units.
Okay. So let's take a look and see what I got here before we walk into the patient's room. So I have 18 units of insulin, that's 12, plus his extra 6 equals 18 units. Okay. I have 0.6 milliliters of morphine, and he needs 6 milligrams of morphine. If his pain is above 6, which it is, it's a 8, so 0.6 equals 6 milligrams. Okay, so his PO medications, I have Docosate. I'm gonna put them in a cup here. Docosate 100 milligrams. Docosate 100 milligrams. I have omeprazole 20 milligrams. Omeprazole 20 milligrams. This one looks like an M&M. I have escitalopram 10 milligrams. Escitalopram 10 milligrams. my 600 milligrams of gabapentin. Then I have two 300 milligram tabs of gabapentin. So that equals 6. $300 and another 300. You know, I think taking these out is the hardest part of all this. All right, there's another. Hopefully, another 300 milligrams of gabapentin. There we go. Okay. Discard all this trash. Okay, and I'm gonna toss the rest of this morphine. Can you confirm that I'm getting rid of this morphine?
Morphine has been wasted.
Okay, morphine's wasted. Perfect. Now, I'm gonna walk into the patient's room after I lock that. I have the key. So I'm gonna say, knock, knock, knock. Hello, Mr. Jones. My name is Corey. I'm gonna be your student nurse today, okay? How are you feeling? Okay. I heard that you were in some pain, so we have some pain meds for you. We also have your daily meds for you, your morning meds, and I have some insulin for you too. Are you allergic to any medications? No. Can I get your name and date of birth? Pat Jones. I check his wristband. It matches up. What I'm gonna do, perform hand hygiene here. Then find some gloves that fit. Okay, since you're in 8 out of 10 pain, Pat, we're gonna give you a shot of morphine first, okay, to hopefully get you a little more comfortable. Do you mind if I do the injection in your shoulder, your left shoulder there? You don't mind? Good, perfect. Okay, so you take a look at your shoulder, Mr. Jones. So I'm gonna roll your sleeve up here, okay? All right. So I'm gonna clean the area with alcohol. Nice and thoroughly, perfect. So where I wanna give the shot is gonna be 2 to 3 fingers down from his acromion process. So it's gonna be right about there in the meaty belly of the muscle. Remove your pillow here, okay, Pat? Okay, so I'm gonna get ready to give Pat the shot. Okay, I'm gonna pinch. Ready? 1, 2, 3. Okay, now I'm gonna hold for 10 seconds. 4, 5, 6, 7, 8, 9, 10. Okay, I'm gonna engage my safety on my needle and dispose this in the sharps container here. Okay, how's that, Pat? Not too bad, good. Okay. All right, Mr. Jones, now we're gonna be giving you your insulin. Your insulin, I'm gonna be giving you 18 units. So your blood sugar this morning was 276. So we're gonna add 6 on top of your normal 12 units. So, do you mind if I do that on your left side? That's okay? All right. Left side of your stomach there, so I'm gonna expose your belly here real quick. Okay, I'm gonna clean you off real quick on the left side here. Okay, thanks, Mr. Jones. Okay, I'm gonna let that dry real quick. So 18 units. Blood sugar is 276 this morning. Okay, it looks dry. Are you ready? I'll give you kind of a pinch here. And then, there we go. Okay, 18 units. I'm gonna hold for 10 seconds. 5, 6, 7, 8, 9, 10. Okay. Okay, now I'm gonna dispose of this needle in the appropriate sharps container. And then, Pat, I'm gonna cap your pen to use for your next dose, since this is yours, has your name, everything on it, this is yours. All right, Mr. Jones, we're gonna get you your oral medications now, okay? Which include 100 milligrams of Docalcate, 600 milligrams of gabapentin for your neuropathy, escitalopram for your depression, omeprazole for your GERD or your acid reflux, and what we've given you is your insulin and your morphine, okay? And the Docalcate is for your constipation. So hopefully after you get these meds on board, you'll feel a lot better, okay? So do you mind if you take all the meds at the same time? You're okay with it? Very good. Here's your meds. Here's your water. Mr. Jones takes his medications. All right, do you have any questions? No? Okay. Have you ordered breakfast this morning? Yes, you have. Very good. It should be here soon. What I'm gonna do is I'm gonna come back in about 30 minutes or so and check on you and make sure that you don't need anything and that your pain is under control. So I'm gonna lower your bed a little bit. Okay, and I see you have your call light right there. Do you need any personal belongings or anything like that close to you? No, you're good? Okay, very good, Pat. So I'm gonna get out of your hair, and like I said, I'll be back in 30 minutes or so. Some hand hygiene. Pick up my things. I'm gonna go back here, chart what I have to say. I have a pen. There's a pen right here. So sweet. Okay. Okay, so he got his sub-Q insulin at 7:30. He got his Docalcate at 7:30. He got his gabapentin, 600 milligrams. Got his escitalopram. Got his omeprazole. He got his sub-Q insulin at 7:30. So I'm gonna put 18 units. Okay. Then he got 6 milligrams of morphine at 7:30 IM. So I'm gonna put left deltoid, and then my initial signature.